Well, thank you all. I'm sure we'll have others trickle in, but I wanted to get started and thank everyone for joining. This is part of a series of webinars we've been doing just to check in on our community, figure out how to help. We did one the other week on with local mayors and city council leaders and seeing how their experience has been and get a bit of a window into their decision making and how they're trying to help their communities. So what I'd like to do is start out, and then of course we'll leave time for your questions. If you can, please send questions directly to Jesse Brooks. So you could take a moment and introduce yourself and what you are experiencing.
It's a little anxiety producing to be parenting from a distance, and so that's a difficult thing, to be away from family, the people that you typically would give a hug to. And so on a personal side, it's also really, really different. This is a radical change, and we're joining you in socially distancing ourselves, both to protect our families and other folks.
Yeah. Thank you. And Erika?
Some of the answers are similar to Enoch, what Enoch just said. So it's how we are practicing medicine right here. So I'm at the Palo Alto Medical Foundation. So I am right here in this community. I see, Santa Clara and San Mateo. And we've divided, I see patients now really, I would say, into 3 categories, right? I see my telemedicine patients. I see patients now over the phone and over video. Like Enoch was saying, we try to do as much because it's sterile, right? And then I'm seeing patients in the Palo Alto clinic. So I'm seeing like new babies and shots and the things that people are well. And then we have tried to take all of our sick patients and we have divided them. We've tried to differentiate sick from well. Also, as Enoch is saying, in a way to decrease the anxiety of being near sick patients, right? Because we want well patients to feel safe to come in. So we have what's called the Respiratory Care Clinic, which is it's a drive-in clinic in San Carlos. And every PAMF and every center in this area has an affiliated clinic that's a car clinic. And patients drive in. And so when I work, so now my time, instead of being what used to be in the clinic all the time, face-to-face with my patients, where fortunately I think I've developed good relationships with many of the people that I know very well. So it can translate over to a video visit, which I think is harder to do, now a third of my time is spent in the respiratory care clinic, trying to see people again in full, goggles, everything, goggles or face shield, N95s, full gown, everything, and doing COVID testing and seeing people when they're in their cars. It's weird. It's in a garage. It is incredibly safe. It is the best practice of medicine in an open, well-ventilated area, but it is different. And so we've had to get our patients used to being comfortable there, and we've had to get used to being comfortable there. Mm-hmm. But I know that we know that it's the best way to give medical care to our patients. So we've had to make many, many adjustments. In the practice of medicine in our group, I feel like daily to every other day, we're making major structural changes of how to best care for patients in this area for population health, and then also for individual relationships within them.
Yeah. Well, that's amazing. You're doing everything so that the patients feel as comfortable and are safe as possible. And as we've heard, that comes with tremendous personal sacrifice as well. I mean, Enoch, when we were doing our prep call yesterday, that was one of your kind of visits home, right? To check on your teenage kids and to make a meal for them. And as you said, make sure they're not burning down the house or something. Again, it's one of the reasons we're just so grateful to both of you and all of your colleagues. Along the lines, I mean, this is clearly a busy and incredibly stressful time for medical professionals on the front lines of the global pandemic. How can individuals support Bay Area medical professionals during this pandemic? And what ways have the community been helpful, and what should individuals continue to do? Erika, do you want to start with that?
Sure. Well, I mean, the first thing is obvious, right? Follow the local guidelines and shelter in place. Wash your hands, wear a mask. be careful, and so that we don't transmit the disease within our population, because by increased disease burden, it's obviously much more work for medical care providers, right?
Mm-hmm.
So we have been fortunate that we sheltered in place early, and we have currently have a fairly low disease burden in this area compared to many other areas. So then as the shelter in place opens, which it will soon, I think then the way that individuals can be really helpful to the medical community is by lowering the threshold for getting tested, lowering the threshold. So if you feel that you have a cough or a cold, any symptoms, or anything, fatigue, temperature variation, I could go through them. Some of them are tummy, so diarrhea, those sorts of things, to get tested, because then we can quarantine sick people more effectively when we start to open up our shelter in place. And then, the donations from the community and the response from the community has been deeply, deeply heartwarming. And I'd like to take a minute to just thank the fact that this community truly cares for its medical providers. I mean, this talk right now is demonstrative of that. And I'm grateful for the ability to speak to our community. But we've had a very generous family that donated 500 lunches to the respiratory care clinic through Coupa Cafe. We've had restaurant donations. Taverna reached out to me this week and asked if they could donate lunches to our Palo Alto site. So there's been just restaurants and people who individually care, which is deeply morale boosting, especially at a time when we all have to make so many changes and so many sacrifices. And then there's the PPE donations, what Enoch was saying. And I found that there's been multiple, specifically Chinese American groups. So, particular shout out to Chinese American groups who I think have watched family and friends in Wuhan. And the generosity has been astounding. There's one group that just helped with a financial donation to our site to help buy iPads for the doctors so that we can do video visits. There's been obviously masks and those sorts of PPE donations, but so that's how the community helps change the structure and change the morale. And then individually, in some ways, taking care of yourself helps us take care of you.
Good. Thank you. Enoch?
I agree with all of that. Absolutely, that taking care of yourself and trusting the people that you've learned to depend on, both your medical providers, your family members, not hesitating to ask for help, because we're finding a lot of people are in a state of fear and don't want to burden people, and are coming into services that could be delivered much sooner, earlier in their illness, and could have be able to heal them much better if you were taken care of earlier. So taking care of yourself is so important, I think, and learning the different ways that both urgent care or emergency, the different settings, how they can each help you. The donations have been amazing. I'm Chinese American, and we've had just an incredible outpouring and of Chinese Americans that have specifically said, I've gone through all of this trouble to try and find trustworthy resources of N95s, gowns, which are the most difficult thing to get, all these incredibly, very difficult things to source, to be able to save their loved healthcare workers' lives. And that's just so incredibly heartwarming in the face of some incidents of anti-Asian xenophobia because of the concern that this virus came from China. The restaurants have been amazing. It's such a morale boost to have my own church, New Beginnings Community Church, Westgate Church, my family members, other friends donate through places like Frontline Foods and through specific restaurants. The Frontline Foods is amazing. It's an organization internationally sponsored by Jose Andres, a world-renowned chef that has been feeding up to 3 million meals a day through this nonprofit. And here locally has an all-volunteer group that coordinates donations to pay the restaurants to bring food to us. Zareen's has been an amazing support for us, feeding us two meals a week. And so these nonprofits can extend the generosity that you'd like to have in sharing your love with your healthcare workers and really boosting our morale. Some Chinese American groups have done that. There's a group called Meals with Love, and they've been feeding us twice a week as well. And so those kind of morale boosts have been incredibly helpful and really encouraging. We have enough PPE because of the generosity of all those donations, and our morale is just increased every day by the smoothies, the boba, the different things that are shared with us, and we're just really appreciative of all the generosity poured out. We really feel loved by the community.
Well, that's great. It is very much so the least we can do, but I'm glad it's appreciated. And you said your brother is buying meals this week through Frontline Foods, you said?
That's right. His legacy venture supported us for this week through Frontline Foods.
That's great. And I'm a regional lead for Frontline Foods, so anyone who wants more information about how to help out via Frontline Foods or to follow up on any groups mentioned here that I can help connect you with, please message me here or just email me after at becker.josh@gmail. Want to kind of cover a couple topics quickly. One is testing. Right now, who should get tested? What's available? I just saw some testings now going to be available in East Palo Alto, a community that very much needs it on coming up May 22nd, 23rd. Do you think folks should get tested? Thoughts on that?
Absolutely. That's essential for as we start to reopen. Anyone with symptoms in most areas of California can ask their local health authorities, your own doctor, where can I get tested? And they can point you to a place in our county here in Santa Clara that's available, and in multiple locations. You can talk to a doctor over the phone and then get an appointment to be able to get swabbed. It's for, previously we were just swabbing people at higher risk. Now we're swabbing anyone with any symptoms. That does change from time to time, and I expect that it'll change as we reopen. We may even loosen it to have less criteria.
I completely agree. And I guess I'm also going to clarify. So there's two different types of testing, right? So there's nasal swabbing, which we're looking for active disease. So nasal swabbing is, we think it's positive about 2 days before people get symptoms and about 5 days after. Of course, there's a range, right? That's when most people are positive. There are some people who stay positive for a month or two. There's some people who are never positive. But that's nasal testing. And then there's blood testing, which is, people say serologies or antibodies. And that's the testing where we're looking to see whether or not your body mounted an immune response to the novel coronavirus, right? So the answer is, who should get tested? Anyone with symptoms that might be consistent with coronavirus should have the nasal swab. If you think you have active disease, in order to basically strictly quarantine and also to take care of you if you get very sick and need to go to the hospital. So, and there is ample testing. We are very, very fortunate. There's ample testing in California, or especially in like the northern California and here in our area. So we are not testing asymptomatic people unless they're going in for surgery to protect the hospital environment. And then in terms of serology testing, many people are asking about that. That's a tough question, and I don't think the medical community has a great answer to that for a few reasons. One is we don't know if it was called confers immunity, which means we don't know if we test you and you even have the antibodies, is if you will then never get the novel coronavirus again. We don't know if it protects your body. We don't know if it will protect you and then you can be exposed and you will not have the disease again, or if you can get the disease many times. We don't know yet. So it's hard. Many people want the test and they are available. In our area, Stanford has antibody testing, PAMF has antibody testing. There is antibody testing here, but we don't really know what to do with the results as physicians. So, and I talk about that more if you'd like, but.
Yeah, well, that's helpful. I'm sure we'll have some follow-up on questions on that. So maybe we'll save that for additional questions. Sure. But I guess along those lines, and you guys both mentioned this, but I think it's important to go over given the importance that I think that you ascribed to it when we talked earlier, which is Um, what routine medical care should people seek in person? And what, what, if anything, should people, put off?
I think if there was like one take-home point, other than sheltering in place, following guidelines, making sure not to spread disease, and caring for each other, the other take-home point I would love to have in this webinar is please seek medical care if you need it for anything that's important. I get very, very worried. We all do, that people are not seeking medical care for that which is important. So we are hearing stories of the heart attacks, et cetera. I had a patient who had appendicitis last week, and the parents were worried that the hospital wasn't clean and didn't want to take him in, and they did. But the fact that that went through their mind is terrifying to me, because a ruptured appendicitis there's a high percentage of likelihood that is fatal or very, very dangerous, right? And the potential risk of being exposed to the coronavirus when we are doing, and when the hospitals are doing everything they can. So to minimize disease exposure, I just want to make sure that people are seeking medical care when they need it. So yes, we very much hope that everyone seeks medical care when they need it.
Mm-hmm.
I feel that way as well. I'm terrified because I see a lot of folks with serious medical illnesses that are coming in much later than they would typically. I just think of my own mom who almost died of a ruptured appendix. She's a stubborn old nurse and knows how to take care of herself, but in that one case, she did wait too long. And I'd hate for anyone to, I love my mom so much. I just can't imagine if I would have lost her to have that delayed treatment. And it was really serious. Lots of people die of sepsis, meaning the spread of bacteria into their bloodstream from serious problems and complications like that. We've had so many stories of delayed care for heart attacks and strokes that have already been there for days. And it's just such a shock because we're used to caring for people and having lots of people come in, and now they're not. And I just want to reassure people that there's ways that we can make it really safe for you. We have ways to just speak with you over the phone so you don't even share any airspace. We can really do a lot to understand what you're experiencing and to address your concerns. We can order tests. We can do a lot of things without putting you at any risk of any kind of sharing airspace with us.
Well, thank you. And you both are saying too that if you've lost insurance and you don't have, and those are issues, you said, the county has help, and that there also are guidelines on the urgent care websites. Any other comment on that?
The emergency room is always available. That is wherever you are in the state. That's always available for emergency care. In some counties, like ours, even some urgent cares are available for care without any insurance, even if you're undocumented, without any language requirement or income requirement. And so typically in most counties in the state, I believe that there's a resource for you to seek care and not wait. If you need help, please go and ask for it.
Right. A couple topics I wanted to get to before we open it up. One, internationally, Enoch, I brought up some of the work you do in international aid, and it's been fun to follow you on Facebook with the work you've done in so many countries. What are you hearing from some of your colleagues around the world who are treating this pandemic?
The friends that I've cared for in disasters are in many places in the world that are very poor. And in many of those places, they're reliant on tourism, and people are not traveling right now. So many people are experiencing not only the worry that they could get COVID from going out and trying to work, but a lot of food insecurity because of the poverty and lack of income. So as much as it is terrifying for them to die from this illness affecting their lungs, there's a lot more suffering just from hunger. and I've worked hard to try and extend help to the places that we go to every year, which is Kenya and Cambodia, because they're sharing with us that there's a lot of hunger. We had existing programs to help in that way, where we supported programs to improve their nutrition, to provide protein and high calorie support in both of those locations, and also Haiti. So as much as we are suffering, as much as people want to liberate their states, people abroad are suffering even more. I don't think as many Americans are hungry as there are in some of the places I've been abroad. So I care a lot about them, and I'm trying to extend help to them as we can.
And is there a place people can go to donate if they want to donate, especially to healthcare professionals, or some of the work you were doing in Cambodia and Kenya particularly?
Absolutely. The organization I'm medical director of is called Jordan International Aid. So JIArelief.org is where we've responded to every major natural disaster since it was Katrina, actually. I was the first doc. My dad and I were the first physicians helping out here locally in our country. We've gone to every major natural disaster since then, bringing teams of physicians for short-term deployments, unlike the longer term, usually many months to years, that you would need to commit to Medicine Sans Frontières or other large organizations. So most of those docs have been Palo Alto Medical Foundation doctors that Erika is currently at. Those are old friends of mine. I was there for 2 decades and moved more recently. So that these are places, people that we trust to, since we're an all volunteer organization, that we deploy all of those donations straight to the people that are hungry abroad.
Well, that's great. Yeah, I remember you saying that originally it was mostly PAMF physicians who you recruited, and now a lot of county health folks are going over with you, right?
That's right. Yes. Yeah. A lot of folks from the county now.
Well, good. Well, thank you. And Erika, I know you've done a lot of international work as well. I wanted to ask you, Erika, one, and both of you reflected too, that one of the real incredible difficulties here is just the mystery of this disease. And to get to another mystery is the Kawasaki symptoms that we hear in children. And Erika, you were saying that that PAMF, I think, reported the first, or Stanford, the first case a couple of months ago. Anything you can share with us?
Sure. I mean, I think it's something I now talk about a lot because people have many questions about it. So it is true. One of the first cases in the U.S., not internationally, was one of our PAMF actually hospitalists. It was a small child at Stanford, and it was written up in the American Academy of Pediatrics, the hospital journal. But more importantly, so what do you need to know about Kawasaki's? And I can describe the syndrome, and it's really complex. And then there's also, what do people want to know for their own children? I think I sort of divide them into 2 categories. So I'm happy to answer as many questions as you want about Kawasaki's in general. In like a 2-liner, it's a vasculitis, which is a disease of the blood vessels. We have many. It has been around for about 50 years we've been describing it. There are about 4,000 cases in the US a year. So it is not a new syndrome. It's a syndrome. We don't actually know the etiology. We don't know what disease causes Kawasaki's. We now know that coronavirus the novel coronavirus can be a trigger. So 3 to 4 weeks after the novel coronavirus, we're seeing this inflammation, this multi-system inflammation. And just in the last few days, actually, there's been a health advisory from the CDC. They're now tracking all the cases. There's been some recent data on, is there a significant increase of numbers of Kawasaki's disease now due to coronavirus? And we think maybe that there is. Even so, these numbers are infinitesimally small. So New York, many people read about the New York cases. We had 470 something thousand people that were infected with coronavirus in New York, and we have 83 Kawasaki's cases in pediatrics. So these are really, really small numbers. So then what do parents need to know, right? I think one of the things parents want to know is my child more at risk than another child? And so far, we don't know if there's a pre-existing conditions or if there's something that makes people more vulnerable, right? So we don't, that is not something we know. So the answer is your child is no more vulnerable or less vulnerable than another, which, you know, that's one of the things we so far have seen. And this changes every day, right? And then the next thing that people want to know about Kawasaki's is, what do I do? And really, it's back to actually my original point, which is if your child has a fever for 5 days, which is the cardinal sign of Kawasaki's, seek medical care. And one would hope that you would, but people are worried about hospitals now. And so there are people who are delaying seeking medical care. And all the Kawasaki's symptoms, there's a constellation of symptoms plus a prolonged fever. And they're almost always diagnosed at about day 6 or 8 or something of disease and of a prolonged fever. So if your child has a prolonged fever, call someone. We're also seeing a lot of abdominal pain because it's a vasculitis and the vessels in the intestines are affected. But this is seek medical care if you think that your child could possibly have a prolonged fever that could be Kawasaki's disease. Because so far, I think all of the kids in New York have recovered. Many of them are recovering with in-hospital treatment. This is not an outpatient disease. This is in-hospital treatment. So I'm happy to answer more questions if you'd like, but I think those are the take-home points.
Okay, great. Well, let's start with some questions. I just saw one from Street that was along the line, something we talked about, so I'll mention that first.
Mm-hmm.
We talked about routine medical care. You know, should we be scheduling teeth cleanings, eye exams? I know my son's getting ready to get his braces off. You know, any guidance there?
I'll answer, and Enoch, you can answer too. I think that right now the shelter-in-place guidelines, we're following county guidelines. So no, current county guidelines are that routine medical care for things that are not urgent and you are not supposed to go in for at the moment. So we will continue to follow county guidelines for that. So the American Academy of Pediatrics had put in place for kids under the age of 2 to do checkups because we need immunizations. And we have now opened it up with county guidelines to under 5 years old, and then the 10 through 13-year-old population, and then the entering college population. Well, of course, we don't know quite what was going to happen to college, but that's a different story. But in order to make sure that people are immunized. So the goal is not to have an unimmunized population in a year. The goal is not to have, this right now is our world without one vaccine. We have a lot of other vaccines that prevent a lot of other illnesses. So we need to make sure that those vaccines happen. So preventative care this true preventative care that prevents problems in the future, yes. Probably braces are going to get put off a couple of months, right? And again, I think we're following county guidelines on that. So, which is, or to get them off, I guess he has to have them on extra for a month or so. I'm sorry. that's a bummer.
Yeah. Nobody wants
nobody wants extra braces.
Exactly. But it's not the worst of the world. Yeah.
Mm-hmm.
Enoch, any follow up to that, or?
You just follow along and see what the county announces. My friends who are dentists are still doing emergency dentistry, but not a lot of routine care. There's certainly optometrists that are available for emergency care, not doing a lot of routine stuff. So just as much of your healthcare needs as you have, just express them. Let your doctor know, let the people who you trust know, and they'll let you know when it is that they can help you with that. And they would be eager to do so as soon as they can.
Yeah. Yeah, and I'll just say I had a very good telemedicine experience through Stanford through the My Health app, and with something on my foot and video and showed, and that was a very positive experience. I will say for a telemedicine experience. Julia, by the way, I just want to throw whenever you want to, if you've something you want to chime in here from what you're seeing from the El Camino healthcare district. Any thoughts or what you're hearing from your board perspective?
We actually have 2 board meetings next week, but I want to reiterate about the generosity that Erika mentioned. The community has been absolutely outstanding, not only with financial donations, but with the food and the lunches and the gift cards for our nurses. And then I think we all had the public safety police display at all of the hospitals. I think you probably did that. I think we had Mountain View Police, Sunnyvale DPS, and then yesterday, of course, there was the big F-15C flyovers, which was pretty spectacular. Did anyone see that flyover? Oh, you did. Fantastic, Dr. Chow. Good. Yeah, it was pretty impressive. Very brief, but impressive. Yes, we're also watching the bottom line, obviously, with not doing, I think we opened up on Monday for other surgeries. We have taken down our emergency tents that we had for COVID, I guess you'd say pre-triage before going in, just to check on everything. Those came down 2 weeks ago. We disbanded our incident command posts that we were managing pretty much 24/7. So things are gradually lightening up, and we hope to get back for business, but that's the big $64,000 question. Nobody knows when. It's all in the control of Dr. Sarah Covey and Governor Newsom.
Yeah, yeah. Well, good. Well, thank you for that update. Thank you for all you do on that board. I know how much you care about it and how much work you put into it. So thanks for that update.
We're all in this together, regional and PAMF, and we're all taking care of the community. So thank you for all you do.
Yeah, and if you want to chime in as we go along, please let me know. I'll turn over to Jesse for folks who've texted him. Jesse, you want to go through some questions?
Sure. Our first question's from Brett. How do you envision elementary schools looking sort of in a medium social distance context?
I suppose I'm supposed to answer that, huh?
Yeah.
I will answer it, but I will also say that as not being an education administrator, it's a little bit like asking an education administrator to diagnose an ear infection or a rash. Like, I don't really know, right? So I don't really know, but I will say that some of the schools are coming out with ideas of cohorting. So the ideas like you have, I guess Pali just came out with the ideas, the high school, of course, but a Monday, Wednesday group and a Tuesday, Thursday group, with the others being online, with the idea that then you have smaller groups.
I'm currently on the Zoom
call. That you have smaller groups. I think, I think that then, I guess the other question, just to step back into, this is the meta question, which is the medical community is trying to solve. And these are the moments when I feel like people are waiting and the medical community is trying to solve things for you, like frantically. And that is, we don't actually know yet when you look at coronavirus, again, 1% to 2% are pediatric patients. So those are your elementary school children, right? We do not know if the reason why children are only 1% to 2% is because they don't get the virus. They truly don't get it. It doesn't latch on and stay. Or because they get it and they can transmit it to other people, but they don't get symptoms. So if they get it and can transmit it to if they're vectors and they can transmit it to other people and they can go from family to family, then we have to be really, really careful with our elementary schools, which is why we shut down. But we're now doing very large, it's an NIH study, I think it's 6,000 kids that was just started a little while ago. Stanford's involved, or maybe it's 6,000 people and families, I'm not positive. But basically we're trying to follow children to see if children are vectors and they host the virus and can transmit it, or if they don't get it, in which case they're not vectors and they're not sending it back and forth from family to family. And we can actually be a little more liberal with our elementary school children. So that is a scientific question that I think that society is waiting to see if the scientific community can figure out. And these are the moments when I'm so grateful that we have that we have the scientific method and that we can solve these things through science and learn them so that we can make decisions, public policy based out of scientific discovery.
I'm also
answer your question. Mm-hmm.
I'm on the school board of my children's elementary school. Yucheng International It's a Silicon Valley branch of a Hong Kong and China-based school that has many tens of thousands of students there. And so they went to shelter in place and tele-learning back in January, and they've reopened. And so we're taking a lot of the lessons that they are using in social distancing. Children are masked every other when they're eating, or they've tried to resume some classes, but much of the work is still done with distance learning. So I think we can take some examples and learning from our international peers, and see how they've been able to successfully decrease the risk of these children bringing it back to their families by the methods that they're using. In Asia, there's very strict mask wearing, and that seems to be a significant way of reducing the spread of the large respiratory droplets that you breathe out to land on someone else, on their face or hands, that they then touch their mouth. So there's a lot of learning that I think we can do. They've been really successful at preventing outbreaks, even though they have relaxed their shelters in place. They've resumed some more of a normalcy of life until they don't. And then Wuhan had 8 cases this past 3 days ago, and they're going to test all 11 million residents. So it is something to still be really vigilant about, but I think we can learn a lot from our international peers on how to do get kids back to school successfully.
Good. Well, thank you. And Brett, I may do a follow-up on education. I got some really good input this morning with some folks. And just thinking about, re-examining it, redesigning education, but thinking about more peer learning and project-based versus tests, sort of in these kinds of environments. So I think there's some interesting things we can follow up on. Brett, maybe you and I can talk offline, given your experience. Brett was head of the Teacher Association in Redwood City and has a lot of experience. So Jesse, what's next?
What should we make of the Stanford study suggesting the infection rate is 80 times higher than reported?
This got a lot of publicity. It was criticized among some. They kind of restated it, but came up with still, finding that the infection rate was substantially higher. Any thoughts on that from either of you?
I believe that there has been some significant concerns about how the study was conducted, but apart from those results, my personal belief is that there's a much higher prevalence than is thought because of the ability for this virus to exist in people without having any symptoms at all. So we just have a hard time knowing how many people are infected and why it's so important that you seek care if you do develop symptoms.
Yeah. Got it. And speaking of Stanford, I was talking to Steve Kirsch yesterday, and he's kind of raised this notion of focusing more on clinical outpatient trials, and has put up $1 million to encourage that. Any thoughts from either of you on that? I could sort of send you his op-ed, but this is a local effort to say, great, how do we make sure we're focusing on these outpatient trials? Any thoughts on that?
We definitely need them. Strongly agree and approve, and am incredibly grateful for people who put their personal finances in places that help the community. That is a public health. That's beautiful. So yes, strongly agree with it. I don't know which studies he's doing. I haven't seen the op-ed, so I'm sorry for that. I do think, I tried to get the numbers. So Stanford just tested all of the doctors, all the healthcare workers. We were given the opportunity to come in and do blood swabs and nasal swabs. And I tried to get the numbers for this, and I wasn't able to obtain them, but just to see what the number in healthcare workers was, to have the original numbers were very, very low, but that was announced in the beginning of the collection. So I would love to know them, but in terms of who is seropositive, like which doctors have converted, because that's important. But yes, outpatient studies are going to change the public policy that we get to make.
Yeah, good. Well, I'm happy to send that around, as well to folks, because I think it's really valuable, and it's an effort, starting here locally. Enoch, you were going to say something?
Oh yeah, I think that those trials and understanding what will help people recover in terms of outpatient treatments is really important. But in terms of stage 2, what's really needed next is, as we open, that we test and do the contact tracing, meaning public health department calling all the folks that had contact with those people who have been found to have illness, and letting those people know that they have to stay home. And the cooperation with that process is the most important next step that will happen. And I have a lot of concerns, just my own personal belief that this is something that has to have national leadership, and our federal government has failed us in obtaining the necessary swabs that we need for that next step. And so I'm hoping that that will be ameliorated soon.
Yeah. I hear you, and it was very painful to watch and listen and read about Dr. Bright's testimony, and how they knew about the shortage of PPE much earlier and didn't act and put folks at risk, and similarly have not come through with a testing program or really national leadership of any kind. So I hear you on that, and I hope that that we can all weather this. Saw the pictures from Wisconsin the other day of bars fully open and gathering, and it's a scary sight. Jesse, next question.
Yeah, I hope I get the pronunciation of this right. Should people get their own pulse oximeter, and or regularly take their own temperature as an early warning system?
So, I'll answer that. I don't think it's a bad, I think it's it's a good idea, especially if you were, it's just actually probably a good idea for many people to have obviously a thermometer at home that works. And having a good pulse oximeter is a great idea. Taking your pulse ox regularly, which is your oxygen saturation of your blood, right? And it drops if you can't get oxygen from your lungs into your blood. And that's one of the primary ways that people have severe coronavirus illness, right? So being able to test that regularly if you are not sick may or may not have a sensitivity of demonstrating illness, and may just make people very anxious. However, if people start to get sick and are at home quarantining, being able to test your own oxygen saturation, if you're trying to do anything over telemedicine, is exceptionally helpful to the physician. So I have seen numerous cases where being able to have that data to give to your doctor while you're sheltering in place, if you're not sick enough to go to the hospital, you're just a little bit sick, but your oxygen's dropping a little bit, it is really lovely to have and to know, because it does demonstrate a level of increased illness that may alert someone to go into the hospital and can help people get help sooner rather than later. So should we all go out on Amazon and buy ourselves pulse oximeters? I don't know. They probably won't have enough if we all do it, but it's not a bad idea to have when people are sick. But Enoch, what do you think?
I agree. I think it is helpful. That is super helpful, because a lot of people have come in and they're low in their amount of oxygen in their bloodstream without any shortness of breath or cough. So it is exceptionally helpful when we're trying to figure out if somebody's sick. I think the most helpful thing is to, when you don't feel well, just to let a loved one, just start talking to your loved one. And as they talk to you, they can tell if you're having to take an extra breath while you're speaking a sentence. They can tell if you look a little peaked or short of breath. A loved one that has lived with you for years will have that much better than a pulse ox or any of the vital signs that we can take from you, to tell that you're not yourself. And if you're not yourself, we're happy to test you, because one of the things that we can test for is just for fatigue. Everybody sometimes feels just under the weather. So we could test you if your loved one says that you're just not yourself, ask us for help, and your local doctors can help you with that.
Great. Well, yeah, I mean, I have a history of asthma. I got one on, for 30 bucks on Amazon a couple weeks ago, and I was worried it was sold out, but it actually came in about a week. And so,
Perfect.
yeah, good question and good answer. Jesse, what's next?
Oh, sorry, it was on mute. What would be, if we get a vaccine, what would be the needed prevalence of people for it to be effective? I guess more broadly, this deals with the anti-vax movement. Would a substantial anti-vax population be a problem here?
When do you want to take this on?
I mean, I guess I'll start. So what you're asking for is what number of people need to have the vaccination and or have immunity to cause herd immunity. That's the medical term, right? So herd immunity is if you have 100 people and 60 people are immune, then if you, in a room, and you spray the virus in the room, what happens? Do people transfer it to each other, or if do these people block it? And then the people who are not immune don't get it because the people who are immune, they don't pass it along their community, right? So the answer really is it's different per illness, and we don't really know the number in coronavirus. We say somewhere in the 60-ish% range, but I don't know the number for coronavirus. I don't know if we know that. Enoch, do you know if we know the number for coronavirus? If we know what the herd immunity number has to be? I don't think we know.
No, we don't.
It's different per illness. So, I mean, in the immunizations that we give, it's different. It's different for polio than it is for measles, and it's a different. So I'm not exactly sure what coronavirus is, but it's large. It's not 5%. It's larger than that.
It's larger than any percent of any location of prevalence in the world right now. Even in some of the highest prevalence places like China and Sweden, they're not yet at herd immunity, nowhere even close. So we're many, many, many months from even the most affected places in the world from achieving herd immunity. And I've heard numbers tossed around, all just speculating that hopefully 70% could be helpful. But we saw that even with certain illnesses like measles, we've had outbreaks with the rates of vaccination dropping just to below 90%, into the 80% range, and then having small outbreaks. So we don't know. And so that's why it's so important to continue to do the social distancing. Yeah.
Okay. Good. And we know we have anti-vaxxers. I know we have them, even in our district. So it's going to be an issue in the state. So thank you for that. Let's see, Jesse, maybe time for one more, and then I want to ask a question about homelessness, and then we'll wrap up. Jesse.
All right. So last question from Steve. Has anyone, what's been the prevalence of infection among people in your workplace?
Well, Erika, I think you said you did the Stanford test. We're not sure the full results yet.
So so anecdotally, of the doctors that I work with, very low, almost zero. The original seropositivity that we heard about, which was like, I guess, 2 or 3 weeks ago at a grand rounds, I just mentioned it, but it was just in the beginning of figuring out how many doctors had the blood test. It was under 1%, it's 0.4%. But again, those are not final numbers. So the answer is healthcare work, very, very small amounts. And part of that has been my experience, and that has been the experience that I am seeing around me. Enoch may have a different experience in the county system. I would say that, I'm incredibly impressed, again, by the differentiation of sick to well and by the coverage of PPE that we have had and how we have done that from day one. So there was not a month or 2 month lag where everyone said, oh, maybe it's not that dangerous and I don't need anything. And because of that, I think doctors and nurses, medical staff, were extremely well protected very, very early on. And we're fortunate to live in a progressive area that does that. So I am grateful that I live in a community that believes in the science of, protecting healthcare workers. So very, very low. The answer is what I have seen and the numbers I have heard are very, very low.
Well, and because everyone sheltered in place, so that we didn't have the overwhelming of the healthcare system that we saw, say, in New York. I mean, I think one of the tragedies of tragedies and sadness of sadness in this crisis has been reading about the healthcare workers who did rush in to help and then themselves and then have become infected. From the person in China who first actually talked about this, who died, to folks in our country. So. But it is good to know that we've been protected here. And actually, Erika, were you telling me about the robotics team that sent designs here? And what was that? Tell us that again.
So lovely. Like when kids step up, I mean, I guess they're grown kids, they're high schoolers, but there's a robotics, I think it's called Curiosity. I think they're mostly gun robotics kids. And they made us face shields, which just is so lovely because it's just wonderful. It really is just wonderful.
It's wonderful. Yeah, I've been wearing them too. Those are great.
Yeah. Well, then as a wrap up, Enoch, I know you've done a lot of work with the homeless population. Maybe you can just talk to us for a moment about the care that the homeless population is receiving or not receiving during this time.
Sure. I'll couch my comments as all of my comments in this talk, and what I'll share here is my own personal statements. I'm not representing my employer or the organization. And I just wanted to share that homelessness has really taken a fresh face for me. I've been volunteering for over a decade with the homeless, and I had started in Palo Alto and then now down in San Jose. We have some of the largest groups of homeless in the country. And so there are all these newly homeless that were just recently, as recent as a month or two, previously employed, had regular income, but now couldn't support their expenses and are staying in church gymnasiums and sometimes in their cars or on park benches. And these are less traditional folks than some of the many other homeless that I've taken care of over the years who have had to deal with mental illness and drug addiction as some of the reasons for their. So I just have so much more compassion now for that process that has caused people to be in that situation, and very glad that there are resources all through the state. Different counties support it to different degrees. Ours supports to a great deal with mobile resources where physicians and nurses can go out into encampments and into shelters to be able to do exactly what you have the opportunity to receive as an insured individual, getting care from your doctor. Homeless folks have folks like us to go out and throw a backpack on our backs and meet them where they are. And that's some of the same kind of strategy that I've used when I've been abroad in disasters is, and even here, the example in New Orleans is we were in the St. Bernard parking lot of the largest Walmart in the country. And that's where FEMA was giving out aid to people recovering from the flood. We saw tens of thousands of people over the month that we were there, and the disaster medical assistance, the Army Medical Hospital that was deployed just a mile away, relocated to where we are. The same thing goes with homelessness. We have to bring the care to them because they oftentimes have less trust for healthcare workers or just authority in general. And as we're able to care for them by bringing the care to them, it improves the health of the entire community. The places where we've had the highest risk of spread you've seen is those cruise ships, nursing homes, places where a lot of people live together, like assisted living, memory care, these step-down locations. My local hospital here, regional hospital, had a lot of the relationships with those, and because of that has some of the highest rates of COVID in the state. Homeless people who stay in shelters have similar risk, and so we've been really active at reaching out and providing resources. We try to recruit for donations of cloth masks for them so that they don't spread their breath as much to each other, and also share with them the ways that they can help protect their residents. So both with medical care and with donations, it's so important that people don't forget about these people in our community that many people just don't feel are most of the time invisible. And right now they're a lot more visible because they're many of the people who are just walking now into the urgent cares and emergency rooms, since less of our traditional patients are. So it's so important. I'm hoping that people would find it in their hearts to contribute, donate, and continue to care for the folks, every member of our community, including the homeless.
And are there a couple of specific resources that are involved with healthcare for the homeless, or that you would mention to us?
Absolutely. I just locally where I live in Palo Alto and where I was at Palo Alto Medical Foundation for, Peninsula Healthcare Connection is part of the Downtown Streets team, and they are a free clinic in North County, in the county I'm in. Each county has their resources. Our county has quite a lot of different organizations. The Office of Supportive Housing is the county organization tasked with placing people, and they work with a dozen different nonprofits, Life Moves, Operation Home. These different nonprofits are able to help source hotel rooms, motel rooms, places that are safe for the people to stay. For example, the 1,000 people who will be staying in the parking lot of Happy Hollow Zoo. One of the zoo parking lots is being used with RVs to house 1,000 homeless, one of the largest attempts at housing the homeless in California, I think. So we have a great deal of resources. There's so many ways that you can volunteer. There's many really reliable organizations. You can tell by the numbers that they're helping. So go and see who's providing care to large groups of people. I've seen great work with City Team and Salvation Army, and a lot of these groups that are just doing amazing, amazing work among the homeless. So many good groups that you can look into.
Great. Well, I appreciate everyone's state audience is amazing. Board member Julia Miller, any final words as we wrap up?
And thank both the doctors for the work that they're doing and the personal risk that they're putting at themselves.
Yeah.
And I'm very impressed, Dr. Cho, with all your overseas work.
Thank you.
Yeah.
You have very good karma.
Yeah.
Thank you.
Well, thank you. So we'll continue to post these resources, and for both of you, send me anything else you want me to distribute. We talked about Jordan International Aid for some international work, Frontline Foods, and there's a website that was posted there. I can also help connect their Downtown Streets teams, Life Moves. And you talked about City Team, Salvation Army, some others that we mentioned. And if there's a way to support the robotics team, you let us know, Erika. But I want to thank everyone, or I want to ask everyone to join me in thanking these two amazing physicians and doctors who are doing so much for their own patients, but also for our entire community. So thank you very much.
Absolutely.
Thank you to you.
And we will keep you posted on the next Zoomcast. Thanks everyone for joining.
Yeah, thank you, Josh. Great event.
Okay.
Thank you, Josh.
Thank you.
Bye.